Hey everyone, it's Dr. Jen here talking about what a normal menstrual cycle and a normal thyroid have in common. So the biggest thing is in society, they are often treated symptomatically. So women with too heavy of cycles or too long of cycles will often be put on birth control. And then when women or men's panels are coming back for their thyroid, if it's irregular, then they're going to be put on the medication needed, whether it's too high of a thyroid or too low of a thyroid. Now, that will help them symptomatically, but it doesn't get to the root or cause. And what's kind of neat is both of these are signs of deficiency in an essential nutrient our body needs. Iodine is a mineral that our body must ingest. It's not something you make in your body. You must get from a food source. So a high food source is seaweed, but that's not something we're ingesting too often. So we must supplement. Our suggested supplement is a nascent iodine. It is well absorbed by the body more efficiently than other forms of iodine. Now, signs of deficiency in iodine is breast tenderness and irregular cycles. So that's kind of the menstrual part. It's the weight gain, fatigue, often seen in thyroid, but it goes beyond that. There's other breast diseases, there's ovarian diseases, and then it goes to men as well. There's prostate diseases that are related to iodine deficiency. Now, unfortunately, we can't be like, yes, iodine's the go-to. You take that, you stay sufficient in iodine, and you won't have these issues. Our body is magnificent, and it's never A plus B equals C. There's multiple factors, but iodine is a huge component to our body functioning as efficient as it can. Now, when we are efficient in iodine, it is one of the building blocks for our thyroid hormone. So when our thyroid functions optimally, our menstrual cycles are more efficient. So we need to make sure our thyroid hormone is happening efficiently. So some kind of neat things, it's not just about your thyroid when it comes to your thyroid hormone. There's more factors. So it actually starts with your pituitary gland. That's initiates. So if it knows you need more hormone, it says, hey, I'm going to do TSH, which is a thyroid stimulating hormone, and I'm going to say, hey, we need to get more thyroid hormone. And your body says, okay, so we have T4, we need to make that into T3, which is our active thyroid hormone that our body then uses for different things throughout all different building blocks of our cells. So in order for that to happen, that conversion needs to happen, which of course it's thyroid hormone. We just need our thyroid functioning, right? Well, our bodies, once again, is not that easy. So thyroid is a small percentage of the conversion. Our larger conversion happens in our liver. So what's important to know is when your body isn't always functioning as optimally as it can, with the different things we talked about, some of them are symptomatic. And so when we work on supplementation with iodine, we start to decrease those symptoms because our body is starting to function at a higher rate. But when you get to the point you're like, hey, my iodine is good, but my body's still not doing everything it should, that's when we have to look at other factors where it could be actually your liver that's interfering with things. So the important thing is we're not just looking at one thing, we're looking at the overall picture because everything affects one another. And your body has huge optimal potential, but if it doesn't have all the tools, it can't function as optimally as it can. And that's what we're all about. We're gonna talk about what different tools your body could use in order to function a little bit more optimally. In this talk, we were talking iodine. Iodine is crucial. It's important to get our foundation and be able to build a better and more optimal body.